underestimated, but they can significantly impact their health. While worms typically affect the intestines, some parasites can cause eye infections. Hair worms, capillaria, are particularly troublesome because they burrow into the intestinal wall, leading to inflammation and rapid weight loss. If you're noticing eye issues in young pigeons, it could also be due to conjunctivitis, which can be caused by bacterial, viral, or parasitic infections. Symptoms include red, inflamed, or watery eyes, and in severe cases, respiratory distress. Treatment usually involves antibiotics or antiparasitic medication prescribed by an avian veterinarian. Treating worm infestations in pigeons requires a combination of medication, hygiene, and preventive care. Here are some effective methods. Medication. Worming treatments like Moxidectin, Evomic, or other deworming products are commonly used to eliminate parasites such as roundworms, hairworms, and tapeworms. These can be administered through drinking water or directly into the pigeon's beak. Regular worming schedule. Pigeons should be dewormed every 3 to 4 months, especially before racing or breeding seasons. Hygiene, loft maintenance, and preventive measures. Keeping the loft clean is crucial. Worm eggs can spread through droppings, so regular cleaning and disinfecting of the loft can help prevent reinfestation.